I even took an AP class in high school, and my parents were like, "Why would you pay the $60 to get the college credit? You're not going to college. Just take the class because it's good learning." And so my parents pushed us academically just because they wanted us to be smart. But I had no intention of going to college. And when I got a letter saying I got a scholarship, a full ride to the University of Nebraska, I was like, I am out of here. I am off the farm. I am like figuring something different out. It was thrilling for me. And I think that gratitude stays with me every morning I wake up. And it has, I hopefully for my whole life, it will.
Unfinished Business Podcast Show with your host, David Slimey.
Welcome back to Unfinished Business, the podcast where we explore the journeys of inspiring leaders, innovators, entrepreneurs, and everything that they're doing day in and day out, including changing their industries. So today I want to introduce a guest who's the CEO of Coleman and Associates. Now, she leads a boutique consulting firm that specializes in process, design, innovation, sustainability in the community of healthcare. Healthcare is a hot topic. Our guest's expertise it really goes from a range of executive coaching to strategic planning to engaging and shaping the national conversation around healthcare. And we're going to dive into that today. So realistically, she has a really diverse background. She came from farming. She's in the healthcare industry. We're going to explore that a little bit. And we're going to talk about her style of leadership in building her organization on top of the industry as a whole. So I'm really excited to have you here. So Melissa Stratman, welcome to the show.
Thank you. Thank you very much, David, for asking me to be here. I'm
Yeah,
excited to be here with
absolutely.
you.
I'm really excited to have you here. In our first conversation, we hit it off right away, and I'm really excited to dive in. So before we jump into all this stuff today, I want to talk a little bit more about your background. Okay, you've been in the healthcare industry for over 25, almost, geez, since you said 95, I believe it was. Um, Give us a little bit of background of how you got into this industry and your roots, so to speak.
Sure. Well, I can say that I think, like many other leaders that I know, I had no intention of going down this road, zero. And in fact, I grew up on a farm in Nebraska, and I was the first woman in my family to get a college degree. And
Wow.
it wasn't first person in my family. None of the boys did either. So I'm the youngest of nine, and we
Wow.
lived a pretty humble, simple life. And I guess the real thing that college wasn't even an option for me. My parents, we never talked about colleges. The only reason I went to college is because God bless them, they offered the ACT during the school day in our rural school. So you didn't have to do the thing afterward. I even took an AP class in high school, and my parents were like, "Why would you pay the $60 to get the college credit? You're not going to college. Just take the class because it's good learning." And so my parents pushed us academically just because they wanted us to be smart. But I had no intention of going to college. And when I got a letter saying I got a scholarship, a full ride to the University of Nebraska, I was like, I am out of here. I am off the farm. I am like figuring something different out. It was thrilling for me. And I think that gratitude stays with me every morning I wake up. And it has, I hopefully for my whole life, it will.
Oh, wow, what a great story. And how was that received when you said, "I'm going"? I mean, how
You
was
know,
that
I mean,
digested?
yeah, I think there was some sort of like, maybe some around like, "Who does she think she is?" Or, "Why does she think she need this?" Or, "Why is that, is that," but my mom said that she thought I would be unhappy,
Really? Yeah.
because getting this different exposure to the world might make me unhappy. My dad said, girls just really go to school for an MRS degree, and I don't know that that's worth the thing to do. So it was hard. It was
Yeah.
hard, but they required me to live at home because I couldn't leave the house, like overnight and go places. So I just commuted every day to and from school.
Wow.
So about an hour drive, no problem.
Wow. So thinking back on that right now, okay, Melissa, how did that background prepare you for your journey? I mean, when you're going through it at the time, you're probably like, "What the heck?" But do you look back on that now and say, "Wow, how did that really did prepare me?"
Honestly, David, I can't. go through a single week without being grateful for the stuff I learned. I think what's really made me successful is the
Yeah.
humility I learned. There is nothing like self-discipline and humility to carry over into the business world. And you get it in spades when you work on the farm and you get up early in the morning, you work in the field, my first big stitches, I whacked my shin with a machete. I mean, it's just the diligence of it and the hard work of it. Of course, I hated it as a kid, and I thought,
Yeah.
"What a rip!" I have friends at school, and they don't have to go through all of this. And my parents were just steady on that, and so it really has paid off because I think when I see a lot of strong leaders,
Yeah.
that's those are the qualities that they embody. And the first job my parents let me get, I was a custodian at a school. And so I would go after my school to a different school that was just not far from the farm. And I would, push a trash can around the hallway while the football players and the cheerleaders were running down the hallway. And again, I was earning my 385 an hour and I was jazzed about that. But that was humbling every day to see kids
Wow.
my own age playing, and it really affected who I am as a leader and what I want for other people, which is the same opportunity to make something of themselves.
Yeah, you take that on early at that age, and you can take that on that you are gonna you're gonna be able to take on a lot through your life. I
Yeah.
really commend you. What a story. What
Yeah.
what a great story of
Thanks.
perseverance, really. And so, did any other your siblings, just out of curiosity, any other other siblings go to college at that point, or were you the first, or should I say, anyone follow your footsteps?
So, even though I was the youngest, I have a sister that just this week finished her boards as a psychiatric nurse practitioner.
Oh my
And I'm
goodness.
so proud of her that she also decided to go to college in her 40s after she had her 7 kids and raised them. She went back to school. And I know the world's changing, but it opened a pathway for my nieces and nephews to also pursue higher
Yeah.
education. And I
What
couldn't be more proud of them.
What an example. I know, right? Like your
Yeah.
nieces and nephews must be looking up to you, and just what an example of that you're setting there. Wow, that's a story in itself.
Well, thanks.
Yeah, that's great. Wow, fantastic. So now let's fast forward. You get into the healthcare industry, right? And talk to us about where you were and the inspiration when you moved into Coleman and Associates and starting that business at that point.
Sure, sure. So, I think one of the things about being a business starter and a
Yeah.
business grower is you have to have a lot of diversity of perspective. And again, I had the beautiful opportunity of not having any freaking idea which direction I was going. So that made it really easy. So I worked at a healthcare market research company. I worked for Blue Cross and Blue Shield for a while. I worked, I saw the insurance side, and then I was lucky enough to have learned Spanish in high school. And so I studied that a bit in college, and I became an interpreter at a hospital, and that
Wow.
opened up a whole new world for me to see all these different things. And the clinicians I working with and interpreting for were super gracious, and they said, "You got to go to medical school. Like you're going to get bored here being an interpreter. Go to medical school. We have letters of recommendation. Highly encourage you." And so I moved actually from Nebraska to Colorado
Okay.
to work on an advanced degree, and I took a job at the community health center. So community health centers, federally qualified health centers, are government supported through HRSA, and they get funding to take care of the underserved and usually the underrepresented. And I
Yeah.
took a job at a health center, and I loved the work that we were doing, but the way that we did the work was so frustrating, like just the rework and a whole bunch of people that were well intended.
Yeah.
Like it was like a third grade orchestra. Everybody's focused on playing their instrument, but there's like no sense of coordination amongst really anybody. And so we hired this guy who was teaching at the Harvard School of Public Health,
Okay.
whose last name was Coleman, Roger Coleman, to come to our health center and help us make things better. And to be honest, when he came in, and I was working at a Spanish speaking only site, and he came in, and I'm like, "Oh no, man, they hired like a tall, bald white guy from Boston to tell us how to do our jobs. You got to be kidding me." And then the tall, bald white guy from Boston started talking, and I was like, "Oh, this could be helpful. Oh, this could be helpful." And so I started experimenting with things. And one thing I've learned in life is that you have to to not be risk averse. I
Okay.
started looking around in college and I noticed that people who were successful took crazy risks. I had
Yes.
one brother who
Yes.
had taken crazy risks in business, and he had done well for himself, and he really it inspired me. And so I started taking risks and doing things we did clinically. And Roger Coleman, who was my became my mentor, he in fact he my father had passed away before I had a chance to get married. And so
I'm sorry.
even though my dad taught me to do things like birth cows and resuscitate pigs and stuff, Roger taught me business. And so he was kind of my business dad. And so he
Yeah.
took me under wing and he's like, "You seem to have a knack for this. Do you want to do this?" And I'm like, "Well, actually, I want to go to medical school." And then the more I started thinking, I thought, no, operations is really my bag. And so
Yeah.
I started working with him. And then I think he realized that I had a different, bigger vision than he did. And so he stepped away and let
Took
me
over the throne.
take over things.
Wow. Now, what
Yeah.
year was this when he stepped away and you took things over?
So he's officially stepped away in 2010, but we started working together in 99.
Yeah,
So
I
I
was gonna
got
say.
11 years of mentorship,
Oh, that's
which
great.
was
So, what can you say to somebody who is either starting a business on their own or getting into business, whatever facet it may be, about having somebody as a mentor or somebody that you
Mhm.
can lean on? How important is that?
For me, I wouldn't have made it. I was scrambling. In fact, when Roger called me and said, "You seem to really have a knack for this. Would you like to work for me?" And actually, I called him and said, "I'd really like for you to consider bringing me in." And he said, "Well, I can give it some thought." And I said, "That's great because I turned in my 2 weeks notice and tomorrow's my last day. So if you're not going to give me a shot, I'm going to figure something else out." And
Wow.
but so I knew I had the motivation. I'm not saying the mentor made the difference, but it
Yes.
did make the difference. Like I had the motivation to do something,
Yeah.
and he was able to help guide me in that direction. And a mentor who honestly is willing, I can't, the number of times that he delivered hard messages to me, like,
Yes.
"Geez, what are you doing? Like, this is it." That was, people don't do that enough for people. And that's a value you can't quantify.
Oh, I would love just listen back to that. Okay. I do say that sometimes in these podcasts, but that was fantastic. Okay. Listen, you can all have great mentors out there and the best people surrounding you, but if you don't have the motivation to really make a difference or actually take that leap and take some chances and take some risks, as you talked about here, Melissa, I think that's a really key point. And then also the thing that I notice about people who mentor, and now looking back and being where I am, and I'm sure where you are today, when people are successful, there was someone who helped them along the way. So the people who are successful now I want to help. I want to serve. I want to help people become more successful because listen, there was a time where I was getting beat up and I had that mentor come in and help me out. I had a few of them as a matter of fact, as we all I probably have had a few. But those are just the 2 points I want to unpack on that and that mentorship. But to be able to not just make it a one-way street where you're trying to get information or get help from somebody, but you're actually bringing value to that relationship is really important. And I think that's what you were saying. I know that's what you were saying there. That's what I heard, and I think it was such a great point. So listen back to that. Sorry, I had to really dive into that and unpack that a little bit. So now you've worked, you've had some good mentorship. You're like, all right, I'm taking the leap. This is now I'm going to control my destiny here. The opportunity presented itself. Now you are taking over, and it's your ship. What's
Yeah,
happening at
yeah.
that point?
So I'm a reader, and I have read a lot about healthcare and about different types of healthcare models across the globe, and about how different models work. Different. Where the United States is the only country that has like a payer source for elderly, a payer source for service people, a private source, a public Medicaid service. Like we're the only country that
Yes.
has this meld of models, and it's wildly inefficient. It does stir up some things, but
Yes.
for me, when I could see and I was on this path, I'm like, oh my gosh, we have the capacity. We work in the community health center space for the most part, but to be honest, we're great at private clinics and helping private practices get good. It's just that what gets me to sleep at night is knowing that the cleaning staff at the restaurant over there can go to the doctor and have an
Yeah.
efficient visit and get what they need and get out, because I've done my part to support the clinicians and the nurses, et cetera. And so, not that I don't want to help somebody who has a great health insurance plan and wants to get their mole removed and doesn't want to spend all day, get the runaround, because
Yeah.
that's also a disaster. My mom tells me all the time what a disaster it is with her private insurance. But the truth of the matter is that the system doesn't work well. And I saw the vision for how to work within the system we have in the United States, and how to find ways to, not always just move the engine forward, but keep the caboose from getting too far behind, and try to
Yes.
keep things moving forward until we can have this, kind of perfect storm of events. Because right now, between legal, between pharma, between the R&D, between all the different payer sources, healthcare is in trouble, and everybody's trying to take a dip out of it. And that's the other thing that I've worked really hard on, is you have to keep your overhead low. You have to keep your overhead super low, because otherwise you can't do great work, because you got to pay for
Is
all this dumb stuff and you can't have an impact.
is that the and I'm kind of jumping. I'm going to jump ahead because we're going to dive into it because you brought it up here. What is the biggest challenge facing healthcare today? I really want to know this. And I mean, I know you ripped off about five of them or so, but if there was one thing that you think would make an impact immediately, or at least move the needle a little bit, Melissa, I'm not going to say fix it, but I'm going to say move the needle a bit. Is there one thing that you see, or even two? I'll take two for that matter, because I'm sure there's 30.
I think it's so multifactorial. You can't do anything because of some of the legal pressures. Like each one of these is a two-sided coin. Like, yes, we need to protect people from malpractice. And no, we shouldn't be chasing down everybody who didn't do this, that, and the other and punishing
Tug and
them.
pull, tug
Yes,
and pull.
exactly.
Yeah.
So I think, one of the biggest things is clinicians, first of all, clinicians run the clinician world. And I think that given the Dr. Robert Pearl, who wrote a book called Chat GPT MD. Was over Kaiser Permanente back in the day.
Yeah.
He wrote this great book, and he mentioned there were like 53,000 physicians that like left practice in 2023. And so the idea that we're losing all these clinicians, and yet still I mean, I was in those classes. You have to go through and learn like the Krebs cycle and all this stuff, but it doesn't really translate to what we're doing today. And so there's got to be a space for some of this technology, but yet there's this protection of like fiefdoms of,
Yeah.
there was a physician's assistant, or NP, in England, who did a cardiac procedure on a patient. And he'd been working for 15, 17 years, I think. And he did this procedure, and cardiologists across the globe like went nuts that now we would be handing this off to a mid-level
Yeah.
provider
Yeah.
rather than a physician. And I understand there's so many things that we need physician wisdom for. All my closest girlfriends are physicians,
Yes.
and they have great wisdom. But when we protect to that degree that people are getting hurt,
Yes.
something's not happening right. I mean, if it takes 2 months to get in to see your doctor and they're doing things efficiently, we don't have enough doctors.
Yeah, that's the truth, right? I mean, it's just that's a big one. And you said something earlier that I want to unpack a little bit, okay? Because and you were saying that you did a lot of reading and a lot of research on other countries and their systems. Is there any system that you identified that you feel you're smiling right now that is at least efficient in your opinion, or are they all just Boubard, or who's doing the best job? I guess that's my question.
I can't say who's doing the best job, because I think what we read in the literature and what we compare in the data and what's the actual practical experience are so different.
Yeah.
But what is confusing for our system is that you have a different experience based upon all of these different things. Like if you're a Medicare patient or if you're in
Yeah.
the VA system, and that's, I think, what gets really confusing. But globally, we have these things around like what people can be sued for and what, these kinds of the prescript, for example, for especially for the underserved, getting medications is outrageous. And when you're thinking about people who are making a decision about buying groceries or buying their medication for the week, they're going to choose groceries
Of
for the
course.
most part. And then they're not going to get well. And so we've tried to create these data driven systems to incentivize clinicians to make patients better. But it's surrounded by this like unspoken bubble that there's only
Yeah.
so much you can do when there's all these poverty and all of these other issues. And since COVID, all of these behavioral health issues that have really surfaced. Not that they weren't there before, but we've just become more aware of them. So I can't say there's somebody that's doing it well, but there's something about having a not orchestrated system that's not working.
Yeah, yeah, absolutely. All right, I'm going to switch back gears here. Okay, I'm going to flip back because I want to talk about your leadership style in building your organization. I do want to come back to healthcare, okay, because I don't want to miss this. Now, give everybody an idea of the size of your organization and the capacity that you have right now, because you're award winning. I mean, listen, you do work across this country. Um, but talk to me about your team members, the size, and I want to dig more into the how you've built that.
Sure, sure. Well, I mean, it just started out with just, a couple of us, and now we've continued to build our organization. We're a multi-million dollar organization that's really focused on um, every state of this country and Puerto Rico, and we work through impacting organizations. And everybody on my team, one of the kind of prerequisites to be on my team is you
Okay.
have to have been across the table. So,
Mhm.
like, I was across the table and had to have the authentic experience of saying, this is ridiculous that somebody else would tell me how to do this thing, because you have to have that experience and work through that pressure. I have one staff member who is amazing, and I wasn't going to hire her. Someone set me up for an interview with her for lunch, and I wasn't going to hire her because she hadn't worked with us and been on the other side of the
Yeah.
table. And then over the courses, in fact, I was actually giving her phone numbers of people she might call for a job. And then over the course of it, she said, "Oh, I did this and I did this." And basically she had done all these things that we had done with organizations. She just didn't know kind of how they all fit together. And so other than that, it's what I have found, and I think the key thing I've learned about staffing is it's kind of what Jim Collins said in his book Good to Great. Like, you have to get the right people on the bus and
Yeah.
then figure out where to take the bus. And so when I run into a person that has like fire in the belly to make the same mission, to make the same thing happen, I figure out how to get that person on my team.
Yeah. They've got the desire. It comes back to what we talked about earlier. You got to have the motivation because you know that you're going to
Yeah.
guide them and mentor them in the right way. And I can't. For those of you listening out there, it's the fire in the belly that she's talking about that will carry you through. I do talk about this. I have this skills and this knowledge chart. Okay. And in the middle is work ethic and that fire in the belly. And I promise you, you don't have to have all the skills and you don't have to have all the knowledge. That can be, you can learn that stuff. You can learn it. But I promise you, if you work and you're disciplined, that skills and knowledge will amplify and grow quickly if you do that. It's a simple formula, but it comes back to Melissa, the strategies that I truly believe in. I think we're very aligned on that. And it's a really good point. So talk to me about your culture now. Obviously, you've got some team members that are sitting on the side. How do you cultivate that innovation, the entrepreneur type spirit? If you do, I mean, you obviously are an
Yeah.
entrepreneur, and I think you almost attract to people like that. So talk to me a little bit about that.
So I had the weirdest experience when I moved to a new house, and the neighbors down the street had a kid that was the same age as my daughter, so like 3.5. And they said, oh, we're sending our son to the local Montessori school. And I was like, oh, I need to send my kid to preschool, right? Like I've read data, preschoolers
Right.
seem to do, I should really think about this, And again, in the spirit of taking risks, I planned to have my daughter as a single mom because I was focused on the business and I didn't have time to cultivate a relationship at the same time. So here I have this kid, I've got this business where I'm traveling, and I went to check out the Montessori school. And I swear there's a point here, which is I went to the Montessori school and I said, I'd like to check it out. And she had me walk up to the little classroom where like the 3 and 4 year olds were.
Uh-huh.
And we looked in the little glass door. And, there's all these little tables and
Right.
chairs, and there's all these little kids with like these little trays. And they had, which startled me for a second, they had like little glass dishes with like black beans and little glass glasses with like, all these little like chips and little things that they were building and making. And I watched one little girl get up, and it was kind of like a car scene in a Disney movie or something, where she gets up and she's holding her little tray with her tottering stuff, and she turns to look at someone, and her tray just like tips all the way off, and everything goes sliding off of it. Glass bowl, glass jar, black beans, pinto beans, like all over the place. Bum, 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 bum. And in no time, like 4 or 5 kids get up totally unprompted. They get up, they run over, they start picking stuff up. One of them grabs a dustpan. They started helping this little girl, and my jaw must have been on the floor because I turned my head to the woman, the receptionist who was taking me on this tour, and I said, how did you do that? And she said, well, it's part of our culture. We bring in one kid at a time rather than starting the whole school year in September. So they learn from each other about this. And at that moment, I thought, that is the answer to every leadership problem that there is. Like, there's something about teaching culture in that way that people just, like, nobody had to tell the kids to go pick up. They just popped up out of their chairs like it was just what you do.
What?
And culture is amazing.
What a fantastic story. I mean, at first I'm like, where is she going with this? Right. And then, but you pull it full circle. Fantastic story. So I obviously that's the way you run your organization, is making sure that everybody helps everybody out. And listen again back to we had 2 moments now. I got to listen back. What a great story in building a culture and really making it simple, right? It doesn't have to be complicated. But it also, I will tell you this: I've worked in some more with some organizations that the culture was really good, and it took years to get to that point. Okay, and I've worked in some organizations who are still working on it for years, who are trying. So I always say when I'm working with an organization and recognize a strong culture, don't take it for granted, because it's hard to develop, and it's like an egg; it's fragile. It can change very quickly. And but what a great point! What a great point. Looking back, what you know, in building your firm, what are some of the key milestones that, if you'd like to share, that helped you grow the organization and shaped it for that matter?
Yeah. There's a few. I think I could probably come up with a zillion. I've learned to not take the knocks that hard.
Yeah.
When back in, I want to say 2013, 2014, 2015, when there was a pullback on some of the federal funding,
Yeah.
that was really hard for a lot of my clients, and that translated to a real difficulty for us. I know at the same time for example, when COVID hit and we couldn't go into health centers. And
Yes.
that's how we feed ourselves, is by going in and working with people and working with working side by side with medical personnel and leadership. And we're not teaching them like how to give an injection. We're teaching them like when to do that in the order of things so that it works well. And those were really hard times. And I remember getting, both of those times I told my staff, I'm like, we will figure out a way to get through this as long as you're willing to do anything that needs to happen, provided, like it's the right thing to
Yes.
do. I don't know what we're going to do, but we're going to. So those low moments really kind of, push us together and helped me, because boy, I lost a lot of sleep during those nights. And then it's a start when I was like doing the books and taking care of a baby, and I'd put her to bed, and then I'd work on the, the finance side of things, and then I'd work on the, it was just a constant, there's a lot of what I would look back on as like kind of gates that I had to pass through, and each one of those to me is like a landing of a staircase, and you get a moment to just take a breath and be like, oh, thank God, we made it to here. And
Yeah.
then, no more than you just turn around and you're looking, you're like, crap, I got another one of these to go up. And it's not exactly like the last one, but I'm starting to get the sense of the pattern that pushes you through. So there's been a lot of those.
Yeah, we need to clip that because realistically, I think you make a fantastic point. Okay, everybody wants to look at the end result versus taking it in steps, and you can get really overwhelmed when you take that approach, and you can really lose focus too. I mean, you can knocked get knocked around and knocked off the pillar a little bit, or the steps, so to speak, and what you were talking about very quickly. So I think that's a huge point. And even the organization, I was in the marketing and advertising space at that time with an organization, and I felt the same way. We needed to, it was like, all right, we made it past that. What's the next thing? Right. And you
Yes.
just have to keep breaking through those thresholds. I'm a big believer in breaking through thresholds, and sometimes they're smaller and sometimes they're bigger. But you had to go through such a crazy time during those 2 years, from 20 to 22, of just, I want to say, probably changing your business in some respects, right? Can you speak to evolving the business
Yeah,
and handling that?
sure. So we have been for years, since probably 2015 or so. So we jumped on Zoom as a team. I read about it in the Wall Street Journal, and I tore out that page of the paper, and I gave it to one of my team members. I'm like, find out what the software is. We got to get online. And that was before video conferencing like was a
Oh
thing
my
that was
gosh.
accessible, like to just like the everyday, as opposed to like, what they had in like the IBM conference room and stuff. And so we jumped on this years ago, and then we worked with, there's a fabulous client of ours, who works in Indiana, and she's a physician CEO. And I keep pushing people. I'm like, you got to move on this video stuff. And this was in 2018, 2019. And she said, I don't want you to teach us. We worked with her in 2019. She said, I don't want you to bring us up to 2019. She said, I want you to get me ready for 2025. And I
Uh,
said, well, I can tell you, I don't know what's going to happen. I don't have a crystal ball, but people are tired of going to the doctor's office for every little thing. So you got to get yourself out of that. So she, even though they weren't going to get paid for the visits, she approved for her clinicians to do a couple of virtual visits every day. So, and then they had to, of course, teach the support staff, how do you find out who's a good candidate for seeing somebody over video as opposed to going in, et cetera. And moving that whole piece forward got them really ready. And then when COVID hit, they were the only one of our clients who was immediately ready to go because they already had this set up. So they just ratcheted that up, sectioned off an area for quarantine, and they were still in business. And so then when other people started to kind of get the sense of it, we had a lot of people who'd been our past clients who had gotten some emergency funding, who called us, and it was our biggest year there post
uh,
COVID, where people called us and said, now we realize we need to jump on these things, and we have some funding to do it and to support us, let's move there. So then all of a sudden we went from having no business to having more than we'd have before. And my chief innovation officer, she was like, I think we can do this, we're just going to have to do things virtually. And then we started tracking the data, and we were like, holy crap, doing things virtually and asynchronous learning actually produces a higher result. So then we started iterating really quickly on it, and it just totally changed. I mean, the core is the same, but the application and the methodology for the business is totally different. And I would never wish COVID to come back. And
yeah.
yet, boy, did it help us.
Yeah, the tools. Again, that's adapting, right? There were so many businesses that suffered during that time, but there were also many businesses that thrived. And it was about adapting and changing. Speaking of technology, okay, in the healthcare industry, how do you see the healthcare process going And I'd love your opinion on this in the next 5 to 10 years, for that matter. I mean, you talked about this 5 year advance with the client you were working with. What's your take in the next 5 years or so with technology?
I think the technology is going to have to grow to fill in the gaps where the people aren't there, and we're going to rely a lot more on lay people and community members to help out their community, their peers and their neighbors. So like all these different types of support staff that are not as highly trained. And
Yeah.
then there's so many things that we've learned from other countries. You know, it was always baffling to me, like in the United States, how we wouldn't give women more birth control pills past a certain point because we needed them to come in and get their pap done or something like that.
Right.
Whereas, you know, you go to another country, you just walk in, you pay your $10, you get your birth control pills, and you leave. And I get that you need to check people's blood pressures and you need to do paps, but the truth of the matter is, it's more important to prevent them from having an unwanted pregnancy and give them the tools to do that. So that was just one example where we ended up, and then since then, the ACOG, the gynecology guidance,
Yeah.
has changed so that we could extend that. So I think we're going to see more of those kinds of technologies, and I'm hopeful that we can get some loosening, not to create unsafe spaces, but to allow technology to fill in the gaps where we can do things. I mean, right now, if I feel like I'm having a cardiac issue and I take in my Apple Watch and I say, here's what I see, my physician's not trained to manage that.
Yeah.
So they're like,
Yeah.
I don't know, let's do an EKG. And it's like, well, okay, I get that this isn't like, Tim Cook's device here isn't like the primo, like, heart
Yeah. Yeah.
diagnostic. But the truth of the matter is that we need these different tools. So I think that there are so many entrepreneurs coming into the healthcare space. And the only thing I worry about, and it's just my own issue, I guess,
Yeah.
is that they can't all make a gazillion dollars and we still keep healthcare affordable. Like everybody wants to create a great tool and then just get their golden ticket and walk away. And uh, that's not going to work. It's
Yeah.
so it's a real fine line. Like we need entrepreneurs. We need the U.S. has always been great at this, but that's where there's going to be some sort of a trade-off between humans and what people can do versus what the technology can do, and it'll be really interesting to see how the two fit together. But I don't quite see it coming together at the table quite
Well,
yet.
I think that's where you're going to come in too, and I think there's a huge opportunity because your team is going to be able to bridge that gap if you understand
That's
what's
fair.
coming from both sides, and you're saying it right now. There's going to be a huge need for that because everybody has the next great new tool, right, in the industry, and the great next idea, and how quickly they come and how quickly they can go. And you've seen that in the last even 5 years. So this has been fantastic. I have really enjoyed this interview a lot. And I want to ask you, another question, a couple questions before we go. But the national conversation around healthcare, obviously, it was a big topic in the election. It's a big topic across the board. How do you see? I mean, I know I asked you this question earlier, but right now, what do you believe is the most critical change that could improve outcomes right now for healthcare?
From the industry is probably different from the personal perspective. Um, there's, for example, there's just a lack of ownership and understanding. There's a YouTube video that
Okay.
tells you to eat just meat. There's a YouTube video that tells you to eat just
Okay.
vegetables. There's
Yes,
there's education around everything, and it's all in conflict.
it
And so
is.
people are constantly chasing one thing instead of another. And, getting back to that idea of self-discipline, like what you put in your body, what you do with your body, what you say, it's all part of the thing. And so I think there's everybody's trying to make money on their portion and say, well, this is why I think this is great, and I'm an influencer that says only this, and it's confusing. And then there's a whole bunch of people that can't afford to do all these things, and they're putting money, like, should they be putting money toward organics? Will that keep them from getting cancer? Should they put money towards supplements? Will that help? And so
Yeah.
there's too much out there. So from the the street level,
Yeah.
that lack of leadership or lack of clarity, or maybe we're just totally obsessed with it because we know, oh, everybody knows somebody who's got some crazy thing happening health wise way before it should have happened in their for their years.
Yeah.
And so we need some sort of clarity around that that could provide a whole lot of guidance to a whole lot of people, because right now it's just not happening.
What just a great perspective, because it's like if you have symptoms of something going on, like the last thing that I would want to do is go to the internet because of just what you said. You're going to get one story about this. You're going to get that's going to freak you out. You're going to hear another story that's going to give you some hope, or it's just it's too crazy. And uh, when when are we going to get to a point where there's going to be some kind of trusted source? I don't know if that'll ever happen. I don't, but I think um, it really is a scary thing, because you could go one day to one thing and hear a message, and then the other day to the next thing and hear a message, and it's so up in the air. Wow, what a great perspective. Melissa, I want to thank you for being here. I think this was a fantastic interview. If someone wants to reach out to you or ask you questions, either let's say they have a practice, or an organization and they want to connect with you, or if they just want to talk to you in general about the healthcare industry or get a perspective on your firm, where can they reach you?
Sure. My website is coleman.care.
Okay.
And my phone number's on there. You can send us an email through there. Me and my team, I'd be happy to. I love engaging with people who are part of the conversation. I'm not going to stop until healthcare is a better place. And so I'm looking for an opportunity to push the national conversation even more forward. And there's a zillion people out there that are doing the same thing that I haven't met yet. Okay, maybe not a zillion, but probably a
Yeah.
thousand. And I'd love to be able to help them and have, be able to be synergistic in that way.
Yeah.
So
Yeah.
yeah, Coleman.care.
Yeah, you said this earlier. One of the things that makes you a great leader is you can look at perspectives, right? And I think that's what you're doing right now. I mean, you identify things that need, I know you identify things that need to change, but you're also looking at it from both sides. And that's the sign of everybody a true leader. So, Melissa, I want to thank you for being here today. I really, it's guests like you that really add value to this show. And for everybody listening out there, I promise, just promise us this: share the show, like the show, share it with one person. You never know who you might impact. So I really appreciate you being here today, Melissa. It was a great interview. I wish you nothing but wealth, health, and success. And the same for all of you listeners out there: wealth, health, and success to all of you. Check us out at salesperformance.com. Like Unfinished Business, share Unfinished Business. We appreciate you. We'll see you next time.
Unfinished Business Podcast Show with your host, David Slimey.